On previous occasions, I've started my contribution by giving my condolences to those who have passed away, and over the last few days we know that there will be families laying to rest their loved ones who have come to the fatal consequences of this virus, and they do so in the cruelest of circumstances, limited to numbers of 10, often with a closed coffin, without the support of their wider family or their community. And Cancorla, tomorrow me and my family will do that with my grandmother, Patricia McAuliffe, a very gentle lady who passed away gently, thankfully, on Sunday night in her care home, surrounded not by her family but by the family that had become her family during lockdown. I imagine she'll be included in the nightly numbers, but as Deputy O'Dowd said, it's important that we know behind those numbers are people. I only wish that I knew the names of the other 46 people that were mentioned last night, or indeed the 3,894 other people on this island who have passed away. And I think there will be time for commemoration. But for now, we must continue to do what we know we must do. The wash your hands, stay at home, keep your distance can ring hollow, but they work and we need them to work. Minister, there is a number of issues which I wish to raise with you. One in relation to the vaccination. Yesterday I started to see online being circulated a website called Omni Calculator. It appears to be owned by a Polish company and purports to be able to predict where Irish people will be in the vaccination programme. It's not a HSE website. It has misleading information, and I would encourage people not to use it or to share it. But it does highlight, I suppose, the thirst for information which many people have to know where they might be in the vaccination programme. And I think a similar platform might be useful if adopted with the HSE when the vaccine programme gets into full swing. Because in reality, the reason why the vaccination programme is not in full swing is not limited by logistics, but limited by the available vaccine. We are not rolling out, we are still rationing. I think the application of the AstraZeneca vaccine with the EMA yesterday will be a key changer in that, because it's the vaccine which allows has the least number of restrictions in a rollout programme. And I look forward to that being available, approved and available to us. It's also important to know that the priority order is not about who is most deserving, and that when the National Immunisation Advisory Committee established the priority order, they did so on the basis of the vaccine itself, knowing, as we do, that it prevents death, but it doesn't necessarily prevent transmission. And I think communicating why the NIAC outlined that priority would be important and deserves us to revisit it and to communicate it to people. Equally, on the restrictions, Minister, it appears that restrictions in other countries will extend to March and even into April. And I wonder now at this point whether we should look at our date of the 31st of January and assess what the likely date will be, and to now make decisions around examinations, around education and around business. There are many challenges ahead for us, but for the sake of those 3,800 people who have passed away on the island, we must redouble our efforts to ensure vaccination and reduction are two priorities.
Thank you, Deputy.